Fertility patients are facing a really tough challenge right now as IVF and other reproductive procedures are being put on hold for now. Joining us to talk more about this is Dr. Deya Dafashy, an OBGYN at CHI St. Luke's. And I'm glad you're talking to us about this because it's a tough time for a couple who feels like they might be running out of time to have a baby and not having an end in sight. What is your advice to couples going through this right now?
Well, the lockdown definitely have affected the treatment of fertility patients. Those patients, some of them are under emotional and financial stress, and they're coming for their fertility treatment, and now they understand that the treatment cannot be initiated. The reason why, of course, is the pandemic that we're all in. So patients can be exposed to the virus when they come to the clinics and fertility clinics, of course, ask the patients to come multiple times for their treatment. Also, we don't know what the effect of the virus have on the embryos. So the advice is to delay the initiation of the treatment until the lockdown is over and the economy is opened.
Do you encourage patients to feel comfortable with it once everything starts going back to normal, that they should really be safe to try to do this again?
Well, definitely, this has to be discussed between the patient and her doctor. There are some fertility clinics and OBGYN clinics that offers telemedicine. So the patient can talk to her doctor and discuss the prospects of future treatment and get the ball rolling. So when the risk of the virus is way down, then they can start the therapy itself and hopefully get pregnant soon. Also, I would advise them that they should start the prenatal vitamins and the folic acid. It's something that's recommended to be started 3 months before they get pregnant. So this is an excellent time to start the therapy before they get pregnant.
That is a good idea because hopefully that can empower them to feel like they are doing something to work toward that goal. Do you have any advice for somebody who just feels desperate right now and just so disappointed that they're not able to do perhaps a planned procedure and just having to keep on putting it off, not knowing when it will come to an end?
Right. The good thing is there's no evidence that delaying the therapy for fertility a month or two or even three has any major effect on the long-term success of fertility treatment. So, I want to reassure them that maybe now, right now is not the best time to start the therapy, but delaying it for a few months, modifying their plans a little bit would help them a lot on the long run.
All right. Well, thank you for that warm advice. I hope that makes a lot of people going through this feel more comfortable about it all. Great to see you this morning. Appreciate your help from CHI St.
Thanks for having
Luke's.
me.